Medical staff in dementia units are in the professionally privileged position of having access to all clinical notes for all residents. Now, for you to be able to work with this medical team, you need to be educated, upskilled, and informed. And to do that, you need to get a copy of your parents' or your relatives' clinical notes, which as power of attorney, you can automatically get. If not, you need to get the permission of the power of attorney. Now, in the clinical notes, you need to understand the medical terms, the medications, the terminology, the behavioural aspect. Just read everything. Sleeping, eating, drinking, the works. Be informed, be updated, so that when you're speaking to the doctor at the doctor's meeting or the nurse, you're on a similar wavelength. You understand from which perspective they're coming from, and you can ask questions indeed that you wish to ask in a manner that they're likely to respond in a decent way. I mean, otherwise, if you don't know the terminology, history, background, you've got no idea as to what's happening, then you'll just get sort of glossy answers and you'll get sort of pushed aside often, saying, oh, mum's a bit disturbed, she needs a bit of medication, and that's about all the information you'll get. Whereas there's a huge amount to know. For example, if the charge nurse rings you and says, oh, mum's a bit unsettled and we want to increase the medication, and you as power of attorney need to give authority to that always being the case. It's like, well, why is mum unsettled? You need to know. And if you ask the charge nurse, well, why is she unsettled? And she says, oh, there's been an incident. Well, then you need to ask, well, what is the incident? And then she says, oh, there's been a fight. Well, then you need to know, well, is my mother to blame or is the other person to blame? And indeed, has there been a witness to this event? And sometimes what can happen is that the witness is a dementia, the clinical, they may say, oh, well, one of the residents said that your mother attacked whoever. I mean, they've got recent memory loss. You can't trust necessarily a dementia resident to be a witness. So on it goes. So, sometimes you just have to dig deep, only if you feel that it's very unlikely that your mother would have done that. I mean, her personality and her history, and even since she's had dementia, if she hasn't got aggressive in your presence or in any one of your relative, friends or family's presence, up to the point of coming into the unit, she's always been calm and stable, and then this event's happening, well, it's good to sort of find out what's going on and why. If though she is cantankerous and does get aggressive, chances are, well, maybe she was in the wrong, and so you can accept it. So you have to use common sense with all of this, and explain to your nurse if she says there's been an incident. Just say, look, mum has always been placid. She's never been aggressive. There's never been an incident in the whole time that she's had dementia with any of the family at all. So for this to be happening now just seems to be very unlikely. So that's why I need to know the facts. I need to know who witnessed it, that it was a medical personnel that witnessed it, why, how, what. It's important to get to the bottom of this, because I know that the medications have big side effects. I want mum to remain healthy. She walks well, she's independent, and we want to keep it that way, which I know we can for as long as possible, as long as she doesn't have heavy medication for whatever reason. Just speak like that. And when you speak in a commanding manner, an authoritative manner, knowledgeable manner, the staff, of course, will listen to that. The doctor comes on board. Call a doctor's meeting if you have to, absolutely fine. Every 3 months is the usual time frame for meetings, but if you're concerned especially about medication being part of the story, within a week you can get a doctor's meeting generally. Just say, look, we need a meeting, urgent meeting, I'm calling for a doctor's meeting, everyone concerned needs to be there, and other family members can come if they're interested and supportive. The carer sometimes comes, the clinical manager sometimes comes, etc., etc. So read up the notes, highlight them, be informed, take the notes with you to the meeting. That always point of power. and on this day, and have all the detail, when the event happened, who witnessed it, what injuries happened, when the nurse called you, your history that you know of with your mother. Look, the doctor will take into account all aspects. No doubt the nurse has said something, no doubt someone else has said something about seeing it, then your dear mother is there, her memory's not great, so that's a difficult equation. But anyway, the doctor will take into account everyone's perspective. And if it's a first incident especially, it's obviously not an ongoing thing. He may well say, oh, well, maybe we got the wrong end of the stick and we'll modify things for now. And I think it's just best we go along without the medication, But it takes quite a bit to get to this point. It really does. It's not like everything's just going to go along rosily in a dementia unit. Your input will be needed, especially if your mother's a bit unsettled, we need the medication storyline. That is when you need to come on board. And also, if your mother's placid and pleasant, dear mother, as many mothers are, let her continue to be placid and pleasant and you support in the background. But if she is becoming cantankerous and aggro, say to her, look, mum, you have to really make an effort to restrain yourself. I've actually seen relatives do this and it is very effective. You have to restrain yourself, you have to make an effort, because if you don't, you're going to be medicated. And they can't have aggressive residents or in dementia units. You might have got away with that at home, but you can't here. And if you're medicated, then all sorts of things happen. No, she'll recognise that it's not good to be on medication, especially if she can see other dementia residents around the place who are shut off and shut down because of it, and explain that to her as well. At least give her a chance of having this cognitive realization that she needs to make an effort. The other thing to do is that if she's quite a feisty sort of a lady, which she probably is if she's being physically aggressive, and it's quite amazing how strong these elderly women can be, by the way, even in their late 80s. Remarkable. Take her out for lots of walks. If you haven't got the time, get someone else, friends or family, lots of walking, lots of fresh air, lots of sunshine, and that'll get some of the feistiness out of her system. Because, cooped up in a dementia unit, upset, feeling unsupported, all emotional, it's the person next to them that, they take it out on. They get fiery. So that's why this out and about and this walking that I speak so much about outside is important. And even if there's a little walking area in the dementia, attached to the dementia unit, if it's downstairs, that's good, fine, limited though. You want a big, long, stretchy walk and out by the beach or in the park or somewhere lovely, so that they can really get that good, wholesome experience. So when they come back to the unit, they're a bit more placid, calm, hopefully happy. It's pretty difficult to be, aggro when the sun's shining and you've had a nice day out. So Residents Rise, Residents Voice, I've written all on these topics. Thank you for your viewing and likes, and please subscribe. Thanks.